Good evening, everyone. Tonight, I'm going to chat a little bit about the calcium score test. I've talked about this test in the past, but an article came out in Jama Cardiology last week. It had a kind of a clickbait type title, a calcium score of 0 is not a clean bill of heart health. So what does that mean? So first off, what is the CT Coronary Calcium Score test? So it's a low dose radiation CT scan. Has about the same radiation as a couple chest x-rays. So it's kind of like a mammogram for the heart. So calcium is something that's supposed to be in your teeth and in your bones. It's not supposed to be in the walls of the artery. So the CT Coronary Calcium Score test, or the CAC, Coronary Artery Calcium Score, ideally your score should be 0. If your score is 0, the reported data is your risk of a heart attack over the next 5 years is reportedly 0.4%. Not 0, but as low as it's going to be. So a score of 0 is excellent. So normally, this is the only test in the world you want to fail and get a 0 on. But this recent report, the calcium score of 0 is not a clean bill of heart health. That's not something surprising to me. Calcium, is kind of a late finding in the walls of the artery. The calcium score test's main benefit is that if you find calcium in the artery, you're also going to find soft plaque in the artery. So the CT coronary calcium score test doesn't require an IV, doesn't require contrast. So you're not directly imaging the soft plaque in the artery. You're just looking for calcium. And the majority of the plaque is actually going to be the soft plaque. So the calcium score test is best generally for people age 40 to 75 years old, and they've not previously had an event. So they've not had a heart attack, they've not had a stroke. Those people are already considered high risk, and the calcium score test really isn't going to help re-stratify you into a different category. They're high risk, they need to be treated as such. But same thing, if somebody's already had a stent, bypass surgery, they're high risk. The calcium score test is not the right test for you. So this is mostly talking to people who are generally probably be 40 to 50 years old. This test, I've had patients in their 70s and 80s still have scores of 0. So those people are still considered low risk of cardiovascular disease. But kind of the sweet spot is catching somebody early, in their 40s and 50s before they even have their first event. And unfortunately, half the time somebody has a heart attack, they have no symptoms before they have the heart attack. So the calcium score test has been a bread and butter test I've been using since at least 2012 to tell people you truly are low risk or no, you are higher risk. And so I know some of you follow me online because I talk a lot about, advanced lipid testing and inflammation marker testing. And so in that kind of carnivore diet world, sometimes it gets a rap that, my cholesterol doesn't mean anything because I have a calcium score of 0, where I've been kind of banging the drum that doesn't mean your arteries are necessarily that healthy. It just means you're not late to the game. It's not a late subway stop, essentially. So to back up a little bit, how do arteries develop plaque? Well, your artery has a coating called the endothelium. It's 1 cell thick. Has the surface area of 6 tennis courts if you took out all your endothelium of your 60,000 miles of blood vessels. The endothelium gets damaged in some manner. Insulin resistance, inflammation, the current virus can damage the endothelium. When the endothelium is damaged, stuff sticks to it, gets retained in the walls of the artery. The wall gets inflamed or starts swelling in the layer called the intima. Then typically softer plaque builds up, different cholesterol deposits, different things from the immune system. Your immune system basically thinks you're having an infection in the wall of the artery and gets turned on. And if you don't shut off that process, the body over time tries to repair this damage by forming scar tissue, and it calcifies in the end. So calcium is a late stage finding. So you want to know where you're at in that progression. Is it just early endothelial dysfunction? Is the wall inflamed? Is there soft plaque, or is there calcium? Those are the kind of the 4 stops before, you've had a heart attack because one of these plaques, which is like a little pimple on the wall of the artery, ruptured. So you want to get to you way before that happens. And the calcium score test, again, has been a great test to tell the people who are the likely low risk versus high risk. So this recent report was kind of interesting for the average person, because I felt like, well, if my score is 0, I must be truly low risk. But this study was done in Denmark, and forgive me, I'm looking at my notes. This is one of my, I'd say, weak points is that I can explain complicated things, but memorizing the exact numbers from these trials, I never stuck in my head. So they did a trial as between patients 40 and 70 years old. It was like over 23,000 patients over a 4-year period. But the difference in this study is that these patients were symptomatic. They were, it doesn't say exactly, but they were like having chest pain with exercise, they were short of breath with exercise, they had exercise intolerance, so they had some reason to go to their doctor and say, I'm not feeling right, and the doctor ordered the next test. So in this study, they weren't actually doing the regular calcium score test. That's usually like a $100 test. They were doing what's the more appropriate test for somebody who's having symptoms. They did a CT coronary angiogram. Those patients had IVs placed, contrast administered, and then pictures of the lumen of the arteries was taken with the CT scan. So you're looking to see, if you're looking down the pipe, is there blockages in the walls of the artery? So their definition of obstructive is a little bit different than what we use clinically. Usually we say somebody has an obstructive lesion or blockage in the artery if there's a 70% blockage in the artery. Typically 70% blockages and greater are going to be symptomatic when you're doing activities because you can't get enough oxygen or nutrients past the blockage. So in their study, they use a titer cutoff of 50%. So, but what was interesting is that, during this test, the calcium score test is essentially free. They throw it in. But what they had shown was that 58% of people under the age of 40 could have obstructive coronary disease but still have a calcium score of 0. It dropped down significantly over the age of 70. People who were over 70 had obstructive disease. They had a 50% blockage or greater in one of the 3 coronary arteries. Only 5% of the time do those people still have a calcium score of 0. So the way this tells me is that, if you're older and you have a calcium score of 0, that's probably a good finding. But if you're a younger person, 40, 50 years old, and your calcium score is 0, that doesn't mean that you're fully in the clear just yet, because a lot of that plaque could still be more soft and vulnerable, and that's the stuff that we're more concerned about, that it ruptures and actually causes a heart attack. The study showed that it was more prone to happen in women and younger people. So again, their calcium score could be 0, but they could have a 50% blockage or more in one of their arteries. So the interesting thing in the whole study is that the prevalence of obstructive disease in this 23,759 people is only 6% of those people actually had obstructive coronary disease, a 50% blockage. They had symptoms, but not everybody had blockages. So how does that happen? Sometimes people have vasospasms. The arteries constrict. They have chest pain because there's not enough nutrients going down there. That's usually an endothelial dysfunction issue. The artery relaxes, the nutrients come back down, chest pain goes away. You can also have microvascular disease. So, your arteries, they're only a couple millimeters wide, but you have lots of small microvascular blood vessels, they're smaller than your hair diameter. Those aren't what you would use a stent in or bypass because it's too small. Treat it with medications, lifestyle, potentially some supplements might help. So they have endothelial dysfunction of the small vessels. They have chest pain. They still have coronary disease. They're still at risk of events, heart attacks and such, but there's not a mechanical opening that's going to help that person. You have to treat them with lifestyle, supplements, and medications. So that's kind of what I got out of that report, was that, a calcium score of 0 is usually a good sign. Again, 0.4% risk of having a heart attack or stroke if your score is 0, all comers. But once you're symptomatic, the calcium score test isn't always the best test. Honestly, that's not even what the American guidelines would show. If you're symptomatic, you got to do something different. Stress test, cardiac cath, angiogram, or a CT coronary angiogram are probably the 3 biggest things that would generally happen. Calcium score tests are best, for people 40 to 75 years old who are asymptomatic. And just want to know, hey, my dad had a heart attack at 65, I'm 45, what is my risk of having one of these done? My dad has not had a heart attack, I am 45, but I've had 2 calcium scores of 0. In the future, I'm probably going to end up doing a CT coronary angiogram just because I'm kind of a crazy biohacker and I want to know, do I have any plaque whatsoever? But there's also some very interesting technology from a company, which I'll talk about in future videos, that uses AI to look at the quality of the plaque. So it'll give you how much calcium is in the plaque, how much soft plaque, but the kind of the key is how much necrotic soft plaque is likely to rupture. And that's the stuff we're really concerned about. That's the holy grail, is that plaque is common. 6 out of 10 people that do this calcium score test are generally going to have a score greater than 0, but we can't always tell who are the people who are actually going to have a heart attack. People who benefit from a stent or bypass, those are people who are symptomatic. People who have no symptoms, stents and bypass aren't going to make you live longer. You're not going to have reduce your risk of heart attack with those type of things. That's mostly lifestyle and medications. Look at your advanced, cardiovascular profiles. The test that looks at inflammation, lipid particles, homocysteine, uric acid levels, the things that you do. If you come see me in the office, we look for your residual cardiovascular risk factors. Because there's about 400 things that put plaque in your arteries, And high blood pressure, high cholesterol, diabetes, smoking, and obesity are the top 5, but you gotta look for about 395 other things that can damage the arteries. So that's what I want to share with you guys tonight. I'll open up to questions if there are any, and then in the future weeks, I'm gonna go through kind of the main tests that look at the health of your arteries. I wanna help you guys learn how to become, heart attack proof. Calcium score test, if it's positive, doesn't mean you're prone to absolutely have a heart attack, but you need to be very aggressive to mitigate your risk factors so those plaques don't rupture. The other test that you can look at for more soft plaque would be a carotid intimomedial thickness test or CIMT ultrasound. And then things that look up earlier on the kind of the subway station would be a endopat, which looks at your endothelial function, and also a pulse wave velocity or pulse wave analysis test with a max pulse. Looks at the elasticity of the arteries. Healthy arteries are very elastic or springy. So if you have healthy max pulse endopat, healthy CIMT, healthy calcium score test, you're essentially going to be heart attack proof. So I'll be talking about those tests on future Monday nights. Yeah, you can see a red light behind me. That is not photobiomodulation. Funny side note, apparently I had a neighbor approach us and say like, hey, what's up with all this red light in your house? And I had to explain that red light's very healing and beneficial for your mitochondria. Maybe I'll point them towards my Red Light Doc website, redlightdoc.com if they want to learn more. But I did play around with my giant EMR Tech photobiomodulation panel at work today. Showed John from BioFit, and then he was kind enough to send a client over, and lady hopefully get some benefit with a big 20-minute session of 5,000 watts of photobiomodulation. So I'll be going back to doing some of my usual biohacking talks and red light talks in the near future, but really want to for the rest of the year focus on what are the big tests you can do to become heart attack proof. And we're going to hit upon nutrition, we'll hit upon exercise. That's what everybody should have nailed down, but how do you manage your stress? I always like to teach people about heart math and how to measure your heart rate variability, and then also talk about how to biohack your sleep, because that's the key. That's when your body recovers, is when you're unconscious, your mitochondria take out the trash with autophagy, and when they're completely broken, they do apoptosis. So we'll be talking about those in future ones. So thank you guys for joining tonight, and have a great week. If you need anything in the interim, just shoot me a direct message. But please share this video with any of your friends that need to hear it. It always helps us when people understand that the power to reduce your risk of heart attacks are in your hands. You just need to ask your doctors and go get the right test. So have a great week, guys. We'll see you next Monday.